Thank you for allowing me to give this presentation today. So, to go over what I'm kind of going to be talking about, I'm going to first talk about my background, how I got into this field, and then we'll talk about some signs of hearing loss and what I see, every day in the clinic. And we're going to go over also the different types of hearing loss and degrees of hearing loss. And then we will also discuss what is dementia and some signs of it. And then we'll look at the relationship between hearing loss and our cognition. And we're going to go over some research that has been done that has looked at this link and what we can take away with it. So to start out with my background, I graduated from Olivet Nazarene University in 2011. I had a degree in psychology and sociology. I first thought I wanted to be a therapist, but I ended up taking some time off after my undergrad degree and eventually went back to Illinois State University and graduated in 2019 with my doctorate of audiology. I then was at a private practice in the Dallas area where it's much warmer there than it is here, especially today. And I was there from 2018 to 2023, but then I guess I missed the winter weather a little too much and came back here. And now I'm at a private practice in Lake Barrington since 2023. And I really came back to be closer to my family. But, one of the questions I really get asked a lot is, how did I get into this field? Why am I in audiology? So one of the main things that I wanted to be in healthcare because both my dad and my grandpa are primary care physicians, and I saw them be able to develop, personal connections with a lot of their patients. And I ended up being able to shadow some audiologists, and I saw how they were able to really change people's lives. It might sound cliche, but with being able to give them, communication with their family back and restore relationships. And as we talk about audiologists and the hearing healthcare field, there are two, really main different professionals that work with hearing in hearing healthcare. And there's, hearing instrument dispensers and audiologists. So, and there are some differences. So with hearing instrument dispensers, they have a certification course, and the qualifications or the criteria varies by state. Tend to mainly work in retail locations like Costco or Sam's Club and focus more on just hearing aids, where audiologists have 4 years of undergrad and then also 4 years of graduate coursework, sometimes 3 years if it's an accelerated program. And then our last year is a full year of full-time in the clinic, primarily work in hospitals, clinics, and private practices, and focus more on the diagnosis and treatment of some different hearing disorders. And so it's not to say that one is better than the other, but I think it's important for everyone to be informed so you can make the most informed decision of who you go to see and just know what you're getting into. And so for some different signs of hearing loss, these are things that, I see every day in the clinic when I have people come in and, for a hearing test, and I'm talking to them. One of the most common ones I hear is just like speech is muffled. It just sounds like people are mumbling, and I think my husband just needs to speak up and then I'll be able to understand him. But everything just kind of sounds muffled. Or could be just having trouble understanding. Some people will tell me, it just sounds like, people are talking to me, but, it's just not clear. I know they're talking. It's not that I can't hear anything. It's just not clear. Or, a lot of times people will say, I hear well most of the time, but if, I'm in background noise, like a restaurant, that's when I know I'm just missing some things and I'm not really sure why. But um, also, one thing sometimes, especially family members will notice that they're turning up the TV so loud and they're like, oh my gosh, if the TV does not get lower, I'm gonna go crazy. And so that's one thing I hear a lot. Another one is just starting to withdraw from your social situations, your everyday activities, just knowing that, well, I can't really participate well because I'm having trouble understanding, and so people start to withdraw. And we also see a lot of people that have ringing in the ears or tinnitus or tinnitus. Either is fine, either is correct. And there's a high association with ringing in hearing loss for a variety of different reasons. And I also hear a lot of people say, I'm just tired of having to ask people to repeat. And then they get frustrated with me, and I get frustrated because I keep having to ask them to repeat. And another thing I want to mention, just almost as an aside, is if you ever have a sudden change in your hearing. So if you wake up one morning and your hearing just seems like it's totally gone, that is considered a medical emergency, and I want you to immediately call an ENT. The sooner you can get your hearing tested and in treatment, the more likely it could restore your hearing. It's one of those things that not a lot of people know about. I've heard stories of people being told it could be allergies and just to wait, and there's no reason not to have a hearing test just to check it, to see where you're at. And so I just want to put that in. If you ever feel like your hearing suddenly changed, immediately get your hearing tested, get to an ear, nose, and throat physician to get, typically they do steroids, but I've seen people wait too long. And so looking at, how prevalent hearing loss is, we tend to generally know, well, the older you are, the more prevalent it is. And that's, generally true, if as we get older, particularly after 65, almost, a quarter is, has some sort of hearing loss. And that's why a lot of times you might hear that, once around 65 is a good age to start getting your hearing tested. Doesn't hurt to get it tested sooner, because then you can get a good baseline test to see where your hearing is at. But one of the things I wanted to mention is that, just because it's more prevalent at an older age, it doesn't mean it's normal. And, we throw normal around a lot, but, what really is normal? But it is more prevalent in older ages, but it's still something to be looked into. So there are different types of hearing loss that I wanted to go over. So this is a diagram of our ear system. So on the left side is the outer ear, also called your pinna, and then it goes into your ear canal, into the eardrum, and then we have those little teeny bones in our middle ear, the malleus, incus, and stapes, and then that goes to your inner ear or your cochlea. And then that cochlea sends the signal through your auditory nerve that goes to your brain. And your inner ear is also connected with your balance organ or your vestibular nerve. So your hearing and balance kind of work together as well. So one type of hearing loss is conductive hearing loss. So this is something that has to do with your ear canal, eardrum, or the middle ear. So it could be that you have earwax or cerumen impacted in your ear canal, and those sounds aren't able to be transferred through your ear system as well. It could be that you have a hole in your eardrum and the eardrum isn't moving like it should be. It could be that the bones in your ears got disarticulated and aren't working properly and cause the sound not to be transferred as it should. And so, we see, also with kids with fluid in their ears where, they have ear infections and the fluid hides behind the eardrum that you can't always see by looking in the ear. And that can cause them to have a hearing loss. And so that's why it's also important to treat those ear infections in kids. Adults get them too, but it's definitely more prevalent in kids. And then there's sensory neural hearing loss, and this is affected in the middle ear or the cochlea. So we have little teeny hair cells inside of that snail-shaped organ, and sometimes they can get damaged. It could be through really loud noises like in the military, or it could be with certain medications. It could be genetic, it could be age-related, and it's definitely the most common type of hearing loss. We see somewhere between 80 to 90% of the hearing loss that we see every day is sensory neural in nature. And so then there is also mixed hearing loss, which, as you might be able to guess, this includes conductive and sensory neural components. So sometimes somebody can get really hit hard in the head, and that could for instance, disarticulate the little bones in your ear, and it could also cause permanent damage in your cochlea. So, that can affect both. And so then you have, a little more going on, you might say. And then one of the things I think everybody wants to know after they find out they have a hearing loss is, well, how bad is it? Is it a lot? Is it a little? Is it some? Is it kind of moderate? Where is it at? And so we measure it in decibels. That's converted to HL. I'm not going to get into all the acoustics of it, but we kind of base it on an average, and that's from 0 to 25 is what we consider normal for adults. And it is a little smaller for kids usually, but that's about average for adults. And then after that, we get into mild, and I'll go a little more over kind of what, different sounds are mild and moderate to, kind of better illustrate it. But then moderate's more kind of average conversation sounds. So when somebody has a moderate hearing loss, that means the quietest they're able to hear is around like average conversation, which if that's the quietest you can hear, if somebody, everybody talks a little different. Some people can talk a little softer, and that could mean that, you're having a lot of issues with just normal conversations. And then when we get a step up from there, which is moderately severe, most people around you probably know you have a problem hearing, and it's not really a secret. And when we get to severe and profound, that's when there's almost safety concerns when we get up to severe and profound with, having trouble even hearing alarms and things like that. So there is also, this is a graph that's illustrating some of the degrees of different sounds and frequencies or pitch. So if you think of a piano that goes from low pitches to high pitches, on this graph on the left is lower pitches and on the right is higher pitches. And then from top to bottom is soft sounds to loud sounds. So you can see in the bottom, jackhammer, jet engine, very, very loud, can damage your hearing, all the way up to the really quiet leaves, rustling in the wind, whispers, and birds chirping. You can see the two people having coffee and talking around that 40 to 50 decibels that we talked about. That's the moderate hearing loss where, you probably are missing a fair amount of speech, but you might be able to compensate for it some, but probably when you're in a lot of noise, you're noticing that, oh, I'm missing some things. And so another graph of your hearing. This is an example of an audiogram. This is when we do a hearing test, we plot it on this graph. And so, again, from left to right is the different pitches, low pitches to high pitches. Top to bottom is soft sounds to loud sounds. The red circles are the right ear, the blue X's are the left. So what this is showing, anything below that line is what this person on average can hear, and anything above that line is what they're usually missing. So the way I explain it is that it's like playing Wheel of Fortune with your ears, where you have part of the sound filled in, but then there's a blank where you're missing. And so you're having to piece together the rest of the information by what you see and by what you know is being talked about to help you bridge that gap. And that's why a lot of people noticed increased issues hearing when we had to wear masks, because that makes it a lot harder for us to bridge the gap. Even those of us with normal hearing use what we see to help us hear. It's kind of counterintuitive, but we do, use our eyesight to help us kind of differentiate what somebody is saying. And this is to say that even if, you have just a mild hearing loss, it really can affect the clarity of speech, especially typically seen when you're in a noisy situation or a group situation. And so we'll see if this will work. I'm not sure. This is a simulator where even if you look at this after the presentation, just to kind of get an idea of what somebody with a hearing loss might be hearing. And so we can play some different snippets of a conversation and look at what somebody with normal hearing versus what somebody with moderate hearing loss might hear. So you can see even illustrated in the type out here, when we have normal hearing, typically can hear all of the speech sounds, but if we go to moderate, you can see all these are blurred out where part of the word is missing. So you're having to piece together, what those sounds were. And when we start to miss that many, it makes us need things louder. It makes us need to be able to see somebody's face to really know, what's going on. And so when we know we have a hearing loss, one of the treatments, particularly for conductive and mixed hearing losses, sometimes there's some surgery. So if you have a hole in your eardrum, there's a tympanoplasty to help patch that eardrum. Sometimes medication, if there's fluid behind your ear, you might need to go on some antibiotics. But as we know, most hearing loss is sensorineural, and with sensorineural, we prescribe hearing aids. And sensorineural hearing loss is unfortunately permanent, and so hearing aids are what we're going to use to help bridge that gap and help bring back the clarity. And sometimes, even those with conductive or mixed hearing loss have hearing aids because either the treatment didn't fully work or they opted not to get it for a variety of reasons. Okay, so now we're going to go into some more of the cognitive related part of the presentation. So when we're looking at dementia, it's an umbrella, and this is just generally, memory and cognitive issues that significantly interfere with daily life. So this isn't just forgetting a few things. This is something that is really interfering with everyday life. So one of the most common ones that we all know of is Alzheimer's disease. So like I said, dementia is an umbrella and Alzheimer's disease is under that umbrella. And it's not a normal part of aging, so we want to differentiate between the two. So when we're looking at it, we want to look at, what is, when you have, cognitive issues, what is it when it gets to the point of being dementia, or what is, normal. And this is also something that is, progressive. If you're somebody that has known somebody with Alzheimer's disease, personally, one of my grandmas unfortunately had Alzheimer's disease, and I saw firsthand how it really just kind of, progressed very rapidly and really kind of destroyed the shell of her. But she was still there sometimes. And I'm going to go over about 10 warning signs of Alzheimer's disease. The Alzheimer's Association reported these, and so we're going to go over the 10 signs and then also point out something that's more of a typical age-related change, because we don't want to be alarmist and think anytime you forget something that it's dementia. I know we all probably are here because we want to do anything we can to help keep our cognition as sharp as we can. And so, but it's also important to keep in mind what's something that's typical. So starting out, this is something that disrupts everyday life. So this is memory loss that really affects, not just occasionally, something that is repetitive, something like forgetting dates or forgetting events, especially when typically they would remember that, or having to repeat questions over and over and kind of like it's not sticking. And a typical change would be, forgetting something and then remembering it later, like forgetting you need to call to make an appointment, but then maybe remembering a couple days later, that's pretty normal. There could be challenges in planning or solving problems. So sometimes troubles with numbers or following plans, if there was a familiar recipe and then, started having trouble following it, that would be a red flag. And a typical age-related change is sometimes just occasional errors in bills, maybe forgot to update your payment information and forgot to make a payment for a bill. I mean, that can happen occasionally, but if it's happening every day for everything, that would be a red flag. Another would be just difficulty completing familiar tasks. So there's a lot of almost repetition in all of these signs. Is this when something's familiar and something somebody has done a lot and then start to have trouble doing it. That's kind of something where we need to pause and be like, why is that happening? So finding hard to do daily tasks, if somebody has a favorite game and then they're having trouble remembering the rules and being able to play it, that's something that needs to be looked into. So something that's typical would be occasionally helping with technology, like Kristen talked about at the beginning. There's a smartphone presentation. It's hard for me to keep up with a lot of technology sometimes, and so needing some help with things like that is definitely normal. There could be confusion with time or place, and so particularly forgetting what season it is, especially if you're retired, to not know what day of the week it is. But not knowing, not realizing it's summertime and thinking it's winter, that's a little more that we need to look at more. And like I said, a typical change, maybe forgetting what day of the week it is. Sometimes I do it. And sometimes I always hope when I wake up in the morning it's Sunday and I can sleep in, but it's not. And so another one would be having some trouble with visual images and spatial relationships. And so we see sometimes, having trouble reading. So some of that verbal vision, having trouble with your brain processing that. And could be some increased issues with balance. But a typical change would be some cataracts. That's pretty typical. And then there could be new problems with words or speaking or writing. So this could be, trouble following and joining conversations. So they're, repeating themselves a lot and not really being able to join a conversation. So like with my grandma, she would just stopped really participating in conversation. She would be there, but she wouldn't really add anything. She would just kind of smile and nod, but she wasn't joining conversations. And so now looking back, I can see, oh, we should have saw that as maybe a red flag. A typical age-related change would sometimes having trouble finding the correct word. I had this yesterday with my office manager. We couldn't think of the word level for the life of us. We're trying to, I forget what we were talking about even, but we were trying to figure out that word, and between the two of us, it took us way too long to remember it, but then we did. So that's really typical. Nothing to be overly concerned about. And sometimes we can see, misplacing items and not having the ability to retrace your steps. So they might start to put things in weird locations, might even accuse others of stealing. And just especially outside of normal. A typical change would be, occasionally misplacing your keys, but then being able to retrace your steps and kind of think back, okay, when I got home, I was here, and then I went to the kitchen, and then I went here, and kind of look back to see where maybe you set them down. I know I do that a lot, especially with my phone. There could be decreased or poor judgment. So sometimes poor financial decisions, poor hygiene, kind of just not taking care of themselves, maybe deciding to purchase or spend their money in ways that is not smart. A typical change would be, sometimes making a mistake like forgetting to get an oil change or something like that. And then there also can be a withdrawal from work or social activities, like we talked about previously. And a sign can be having trouble joining conversations. And so when that starts to happen, it's kind of natural to then start withdrawing from activities maybe they used to do, and just maybe stop going to church, stop going to their clubs, stop going to family events because, well, I can't really participate. I can't follow the conversation. And typical change would sometimes just being uninterested in certain family or social events, maybe something that when you were younger, you would kind of just push yourself to do or feel like more obligated. But maybe as we get older, we're just like, you know what, I don't want to go, so I'm not gonna. There also can be changes in mood or personality. I think this is one people a lot of times associate with Alzheimer's, thinking of the person that gets really angry. It doesn't happen for everyone, but there can be mood changes, can become depressed, can be fearful, easily upset, and just confused. And a typical age-related change would be, sometimes we develop very specific ways we want to do things, and it can be a little frustrating when that routine gets interrupted and, to kind of get stuck in our ways, as that cliche goes. So when, kind of looking at the signs of hearing loss and the signs of dementia, probably saw some similarities between them. So we'll see, having asked to repeat. We see that with having cognition issues, and we see that with hearing loss. And we can also see a withdrawal from social events. Could be that, we can't hear it, and so we can't participate, or we can't participate because of cognitive issues. And then that can also lead to depression when we're not able to do things that we once were for whatever reason, it just caused us to kind of, to get depressed. And then also trouble following conversations. We saw that with dementia and we saw that with hearing loss. And so now I want to look more into some of the research and studies that have been done and that have looked at this kind of association. They can be similar, but, are they related? And so there is one study that asked, is age-related hearing loss a modifiable risk factor for cognitive decline and dementia? And so they did a meta-analysis that had over 20,000 participants. And a meta-analysis is really nice because they don't have to conduct the studies themselves. They take studies that have already been completed and they take their data and to combine it into one. So they're able to have a more robust sample size and be able to have, a stronger conclusion because of that. So they found that there is a significant association between hearing loss and cognitive impairment and dementia, which means that if somebody had a hearing loss, they were more likely to also have a cognitive impairment. And so they concluded that, age-related hearing loss could possibly be a modifiable risk factor for cognitive issues. Another study was the Baltimore Longitudinal Study of Aging. And this was a prospective study of about 700 individuals. We see the sample size is much less, but this is an individual study and it was prospective. So they looked at them, I think, after 12 years. Yeah, after 12 years and to kind of see how they did. And they looked at the hearing loss and their cognitive issues. And so they found that people with hearing loss are almost twice as likely to develop dementia. And, when I was reading the study, almost twice as likely is very significant. And we also see that it increases with the degree of hearing loss. So with somebody with mild hearing loss, they're just under twice as likely. But then once we get to moderate, it's 3 times, and severe is about 4.5 times. And that is staggering to know that, somebody with a moderate hearing loss is 3 times as likely. And another prospective study was done, and this one was a 25-year study. Had almost 4,000 participants over 65 years. And part of the participants at the beginning reported some hearing problems and some reported that they didn't have any hearing issues. And so with the people that reported hearing problems, they did show an increased risk of depression, dementia, and disabilities of daily living, which just means like cooking, cleaning, hygiene, that kind of things. And they found that mortality wasn't associated with self-reported hearing issues. They just saw that there's that increased risk of dementia and depression. And so now that we know, so we've established that there seems like there's some sort of association between hearing loss and cognitive issues. So the next natural question to ask is, well, we also know sensory neural hearing loss is the most common, it's permanent, and the treatment is hearing aids typically. So do hearing aids help? That is really the main question that we want to know. And so there was a National Health and Nutrition Examination Survey. They had almost 10,000 participants, and they looked at them in 1999 and then in 2012. And they tracked their hearing loss and then also reported hearing aid use. And so they also adjusted for different confounding variables like demographics, degree of hearing loss, and medical history that could kind of cause different results because, as we know, somebody with a higher degree of hearing loss are even more likely to have hearing or cognitive issues. And so they found that hearing loss was an independent risk factor for mortality, which means, disregarding the demographics, the degree of hearing loss, or medical history, that it was an independent risk factor for increased mortality. But the good news is that that risk was lower with the people that used hearing aids. It could be that with the hearing aids, they were more able to go out and do things. It could be that people who wear hearing aids are more likely to take care of other health issues, but it is an interesting finding. And they also found that those with hearing aids showed no additional risk of dementia compared to those with normal hearing. And I think if you take anything away from this, it's this point right here. It's that, a lot of times we can't prevent hearing loss. So if we have a hearing loss, we can use hearing aids. Hearing aids are not perfect. I'll be the first one to say that. But if we can keep our brain stimulated where, if you don't use it, you lose it, I like to say. And we can help keep our brain active and help guard against cognitive issues. It doesn't mean it's not going to happen, but it's one of those things that we can control. And they estimate that they could reduce dementia by about 8% if all hearing loss was treated. They also found that just in general, global cognitive function scores improved short and long-term memory, attention. And so it seems to suggest that hearing aids can help with just keeping your brain, your cognitive function in better state. And there's also other research about hearing aid benefits, just showing improved quality of life and, of course, speech understanding, and then, decreased depression because, we're not feeling like we have to be isolated. So we're going and doing things and being more social, and decreased anxiety when we're in those social situations, not being anxious, oh, am I even going to be able to hear or understand this? And then also decrease stress. There's lots of research that shows that people with hearing loss are more tense and tired by the end of the day because they're having to focus so much on just understanding or hearing what people are saying that those of us with normal hearing just take advantage of because it's just instantaneous. And so it's almost like our brain has to focus more there, so we're losing other parts. And one of the most recent studies that came out, and that's what really put it in the news, where I think it really gained a lot more mainstream knowledge of, was the Achieve study. And it's the Aging and Cognitive Health Evaluation in Elders. And they had the largest randomized controlled clinical trial of hearing aids looking at reduced cognitive decline in older adults. And when we're looking at studies and researching different topics, randomized controlled clinical style is the top tier. If we can get that, that has the best results, the most significant results. And that's why this study was, such a big deal. And they looked at older adults with mild to moderate hearing loss. And they had two groups. One group had instruction and counseling with an audiologist. The other group had health education with just a general health educator. And they found that hearing intervention slowed cognitive decline by almost 50%. And that is huge. So I want to also summarize some of the things we can say and some of the things we can't say. So, one thing we can't say is that hearing loss causes dementia. So, And we also can't say that dementia causes hearing loss. You know, we know that they're associated, but we still do need more research to really further investigate the link between them. One thing that we can say is that those with untreated hearing loss are more likely to be diagnosed with cognitive issues, and that it seems that we can mitigate that increased risk when we have a hearing loss by treating it with hearing aids. And so a couple of the important takeaways are to really talk to your primary care physician about getting screened for dementia and being proactive about it, and to get your hearing tested. It's really never too early, and so that way we can have a baseline to then compare over the years to see if there's been a change. So that just gives us more information, and to not wait to get treatment with hearing aids once they are recommended. There's lots of options out there now, and we can find something that will work, and that's really the most important thing that we can take away, and to know that there is something that can help and something that we can do to help keep our cognitive function, as long as we can.